let's give a warm welcome to Dr. E.
I put a spell on you, and now you're gone. My whammy fell on you.
Was that supposed to be weird science? I thought it was supposed to be weird science. Okay. Good morning, everyone. First, I want to acknowledge you. Thank you all for being here so early. And I know we all went through the rain yesterday. Some of my slides are a little text dense. I will not be reading through them, but I will be looking down sometimes. I like to just elevate anyone's pet peeves of why isn't she looking up? This is why. Because we're doing Intro to Functional Medicine, which is basically intro to all of medicine. How do you do that in 90 minutes? So there's going to be moments where you get what is she talking about? How does that work? I never heard of that. It will all come together, I promise. And then I really am looking forward to your questions. Okay. So let's start. Already started there. It's because I brought it here. Okay. That's how dense they are. Amazing. Not working. Okay. Everything works. Okay, we're going to do it manually. How about that? All right. So we're going to, of course, these are our objectives. We're going to define the core principles of functional medicine. We'll identify the benefits, and then we're going to apply. These are some disclosures. As we mentioned, I am the founder and owner of EG Prep, an educational company. You'll read this. I'm not selling you anything. I created a map for the lecture because this is going to be so dense, and every few slides, I'm going to let you know where we are in the map so you don't get lost. So we're going to recognize the difference between functional and conventional medicine, because that might be a head scratcher for some of us. We'll examine the core principles of functional medicine in contrast with conventional approach. And then, of course, we're going to do some case studies, and we're going to discover new labs that will blow your mind that probably most of you don't even know exist. And then we're going to use all that to create some treatment protocols. And of course, we'll do some pharmacology of supplements, which I am hoping that is going to be new for most of you. Instead of pharmacology of medication, we're going to talk about supplements. So let's recognize the difference between functional and conventional medicine. First things first, what is functional medicine, right? Functional medicine, this is a sentence that's going to be annoying. We're going to break it down. It is a patient-centered, systems-oriented approach to healthcare that focuses on identifying and addressing the root cause of disease. Hopefully you're going, what does that even mean? Which is great, we're gonna break it down. Patient-centered care. We all say that. It's in the slogans of the companies we work for, but we don't actually do it in conventional medicine, because you're going to see that this is a fully collaborative approach. You're going to talk to your patients, you're going to give them options, and together you're going to prioritize. It is completely a different way of doing medicine. Systems biology, this won't make sense for you right now, but in a few slides it will. It's a different way of looking at the body, and more importantly, how the body parts interact with each other, because we don't do that in conventional medicine. Neurology is in one office, GI is in another office, and we never really talk about how is it connected? How's my belly actually connected to my brain? And of course, root cause focus. You might think you're doing that in conventional medicine, but we're not. And personalization. Every single treatment is personalized. And if you're thinking, of course, I personalize all my treatments, even when I take care of my patients right now in conventional medicine, we don't. We don't. How do I know that? Because we look it up to date. Okay? It's an algorithm. What do I do here? Do this, do this, do this. It's not personalized at all. So let's look quickly at a difference of what do we mean. So let's do a case study. 38-year-old woman suffers from debilitating migraines for years. She had the full migraine workup, right? She had the MRI, she had the blood work. We made sure she doesn't have a brain tumor. We're like, okay, there's nothing more we could do. So we're focused on the symptom. We're going to give the headache, right? She has a headache. So we're going to give her something to manage her pain. But her headaches don't go away. Her headaches don't go away. So now let's see what happens in functional medicine. And don't worry, this is just a quick overview so you can start understanding the difference. This same woman, same case study, okay, her MRIs are normal, everything is normal. Is it this one or is it this one? Is it this one? We can hear me? Okay. Her MRI is normal, we assumed everything is fine, but in functional medicine, suddenly we take this migraine, we do a deep dive, and we realize this woman has something called leaky gut. which you're going to understand now and in the next lecture if you're hanging around. And we're going to find out that she has mold exposure. And now, instead of giving her more medication for her headache, we're actually going to heal her gut and remove the mold. And within months, her migraines disappear. So we're starting to appreciate how different the treatment is. So let's go through some myths of what functional medicine is, okay? And I've been called everything. I've been called a quack. You name it, it's fine, okay? You're gonna see that none of that is true. And if healing people and fixing people and curing people makes me or you a quack, consider me a duck. So, myths. Functional medicine is alternative. It's unproven medicine. Not true at all. We are talking about evidence-based medicine using the latest scientific research. Wait till you see the labs that are available to you. And it actually integrates conventional medicine with labs and personalized treatment to address the root cause. So it actually takes everything. It's actually not either or. And the next myth is that, oh, it's just diet and supplements, right? You're just taking supplements and you're just going to have really expensive urine. And that's not the case at all. You're going to see that we're talking about, tell me, did you say there's expensive urine? Yeah, it is expensive urine because it actually is going to cure you and heal you. It's amazing stuff. So we're going to talk about detox protocols, and we're going to talk about chronic infection management. We're going to discover something, there's a lot of infections that are undetected in conventional medicine. And we're going to talk about mitochondrial and cellular support. When was the last time you went for a primary care checkup and said, I'm tired all the time? And they're like, well, how's your mitochondria doing? Right? Never. So functional medicine is actually rooted in evidence-based practice, cutting edge genomics, nutrition science, environmental medicine. Environmental medicine is a big one. Like, are we exposed to mold? Are we exposed to heavy metals? And the lab tests we're going to go over. All of this is to say that functional medicine is not alternative. It actually combines conventional with a root cause analysis. It combines it, and you're going to see that, in fact, I would never take a patient who didn't go through the conventional medicine route first. I'm going to want a patient, like in the case study, that did the MRI, that did the blood work, that did the CAT scan, that did the GI, and all the doctors said, nothing's wrong with you. I don't know what else to do, right? It's in your head. And then we layer on top of it a brand new way of looking at things. Quick list of the type of conditions that managed by functional medicine. Basically, all of them. Autoimmunity, RA, lupus, chronic inflammation, metabolic disorders, digestive disorders, hormonal imbalances, neurological, cognitive disorders, cardiovascular, mental health, chronic fatigue, environmental, skin disorders, bone and joint, you name it, we're managing it. And where it's adjunctive is if you have an infectious disease, functional medicine can help support the immune system. If you have surgery or trauma, again, functional medicine can help support the healing. Same with cancer. As you're undergoing treatment, you are going to have a better success rate if you use it adjunctively. And of course, with genetic disorders are what they are, but you can use it adjunctively to help support flare-ups. But there's two conditions where functional medicine absolutely dominates. And the first one is longevity. We absolutely do not manage longevity in conventional medicine. We do not talk about longevity. We talk about, you have a risk for a heart attack, you have a risk for a stroke, but we don't talk about what are we going to do today in our annual wellness to make sure that you not just live longer in a home connected to tubes, but you're actually going to be able to lift your suitcase overhead, pick up your groceries. When was the last time you had that conversation in primary care? Right? So longevity, functional medicine excels in longevity. Another area that functional medicine dominates in, the mystery patient. The mystery, do you know what I mean about the mystery patient? Yeah, everyone, okay? You know this patient, right? She comes in with a thick file. I said she on purpose because generally speaking, it's the women who experience the most medical gaslighting. So come in with a thick file, multiple specialists, and she says, something's not right. I've been everywhere. I've been to my MRI. I've been to the neurologist. Something's not right. And she has brain fog, and she has joint pain, and she has GI issues, and she has mood swings, and she has skin problems. Right? And they've tried it all. And now she comes to you, and you're like, well, what am I going to do? right? She's already went to 10 different specialists. What am I going to do? So you're going to try, but there's nothing left to do. So what are you going to say? Maybe you're just a little stressed, right? Maybe it's menopause. Maybe it's postmenopause. Maybe it's because you have little kids. Maybe it's because you have older parents. Everything basically saying it's in your head. That is the classic experience of the mystery patient. And they're dismissed, or they're given another term, fibromyalgia, which actually makes my blood boil. Functional medicine loves the mystery patient, because here's the thing. Just because conventional medicine can't find it doesn't make it a mystery. The problem isn't the patient. The problem is that conventional medicine is limited. It's wonderful, we need it, but it's limited. And it's limited because, first of all, it deals with symptomatic care, right? It treats isolated symptoms. Here's your headache. Here's something for your reflux. Here's something for your joint pain. It really deals with symptomatic care, and it's fragmented. Right? How many people are in primary care? How many referrals are you writing out? Oh, you go to neurology, you go to GI, you're just giving out referrals. So it's very fragmented, and in that case, it's really limited. Whereas functional medicine is holistic. It takes the patient as a whole and its systems, and you're going to see what I mean in a moment. And from the moment you sit with your patient, I sit with my patient, my consultation is an hour. When was the last time you could give your patient an hour? I know everyone in this room wants to give their patient an hour, but the system does not allow it to be for an hour. So from consult to history taking, which you're going to see how we take a history in a moment, to testing, to diagnosing, it takes the patient's entire circumstance into account, not something we could do in a 10-minute primary care visit. And you get long-lasting, often curative results. So here's the other concept. By the way, my timer is not on in case anyone's interested. Here's a foundation concept here in functional medicine. You have, on the left here, you have depression. Depression is a disease, is something that we're managing. And there could be a lot of reasons for it, right? It could be omega-3 deficiency. It could be from low thyroid. It could be vitamin D. So it could be a lot of causes for one condition. But conversely, you can have one cause that causes a lot of conditions. So you might be inflamed. Maybe you're exposed to mold. Maybe your belly's a mess. And that will cause depression, arthritis, cancer, diabetes, heart disease. It's a whole different way of looking at things. So imagine if we find the root cause of inflammation, suddenly the depression goes away, the arthritis goes away, the cancer improves, the diabetes improves. And same thing when we treat one condition, we don't just give it one thing. It's not a Zoloft deficiency, right? Maybe they need a few things happening here. By the way, I'm not against medication. I prescribe them all the time, but I just want us to be open to other things. Okay, so we recognize the difference between functional and conventional. We're getting some people maybe are resistant, some people are excited, some people are like, what is this lady talking about? But let's see where this takes us. So now we're going to examine the core principles of how the history is different, what is the whole interaction different. So there's a few tools in functional medicine that we need to know. We need to know the timeline, which we're going to go over, the functional medicine matrix, then we're going to go over some lab testing, and then we're going to show you how to put together a treatment plan. This is the functional medicine timeline. This is how we take a history. Take a look at this arrow here, okay? Notice, so this is the timeline. I ask everything that happens with my patient here, right? So sorry about that. So notice that it starts, you see where it says birth? Notice that there's a space before birth. I don't just care what happened today. What happens when you come into conventional medicine? How are you? How is everything? Good. You have a sore throat? Great. When did it start? 2 days ago? Great. You know, and then you're going to start telling me, 5 years ago I had a sore throat, felt the same way. No, ma'am, I don't really care about what happened 5 years ago. I need to know, when did it start? Is it old cards, location, my duration? Is it radiating? And you're like, no, but I just want to tell you that ever since my car accident, no, there's no connection between your car accident and your sore throat, right? That's the experience. In fact, you have limited time, so you have to get your patient focused. Don't tell me what happened 5 years ago. Don't tell me what happened 10 years ago. In this timeline, not only do I care about what happened 5 years ago, I want to know how you were born. Vaginal, cesarean, big difference. You're going to see why, especially if you're staying for the microbiome lecture. And I want to know what happened prenatal. What were you exposed to? What genetic predispositions? Because guess what? If grandma has Hashimoto's and mom has Hashimoto's, and you're coming in fatigued and your TSH is normal, guess what? You're cooking Hashimoto's. But I know that because I actually asked you what's happening, right? So we want to know what's happening before birth. I want to know what's happening at birth. I want to hear your entire life. This is why the consultation takes an hour. The patient comes in all the time. They tell me everything because they're so rushed. They're so used to being rushed. I'm like, great, amazing. Now let me ask you 500 more questions. What happened 0 to 10? What happened 10 to 20? Seriously, this is how I do my consult. What happened 20 to 30? What happened 30 to 40? And we write it all down. So we start getting the timeline. I'm going to show you the other parts in a moment. So that is the timeline. So it's a visual tool that we use, and we all use this in functional medicine. Some of us, we start off actually with that piece of paper, and then eventually we come up with our own systems. But it actually explains the patient's health journey to us, and it identifies critical life events. Because guess what? That car accident actually is really important, because that probably really disturbed your microbiome. I don't know why I'm picking on you. You're just here. It probably really did disturb your microbiome, and ever since then, you've been susceptible to things. I really do want to know it, okay? And it also looks at something called antecedents, triggers, and mediators. Let me show you what that means. An antecedent is something that predisposes you to a health issue, right? So we just said a genetic predisposition, right? Mom has RA, so your joints hurt first thing in the morning, but your RF factor is negative, you're cooking an RA until proven otherwise. Early life experiences, childhood trauma, frequent antibiotic use, exposure to toxins, and what's happening, what are you exposed to now? So these are the things that set the stage for you to become sick. And that's really important because, you know, it's really, really, really clear to us emotionally, psychologically, if I'm having anger issues now or relationship issues, right? I'm going to go to my therapist. I'm going to figure out what happened to you as a child. And I'm going to understand that there was an impact here. The same is true physically. Things that happen to you, things that set the stage. If you were in the hospital in and out, and then eventually you got your tonsils removed, and you're on antibiotics every 6 months from age 0 to 5, if you think, you get one microbiome, if you think that doesn't affect your microbiome and carries with you, right? Doesn't make sense. It's so clear to us psychologically, but physically it's like, no, you're a sore throat. I just want to know about the past 2 days. I don't know anything that happened. So antecedents predispose us. Mediators are the things that perpetuate our health condition. So they either maintain it or they make it worse. So classically, stress. If I already have an issue and I'm under a lot of stress, it's either going to maintain it, meaning I can't really get better, or it might actually make it worse. But also the standard American diet. The standard American diet is going to take whatever I have and I have no shot of getting out of it, or it might actually make it worse. If I don't sleep, it's going to make it worse. If you have brain fog and you don't sleep, how are we getting out of it, right? By the way, a little teaser, lack of sleep is causative for dementia. Just hold that in your pocket, okay? If it scares you, good, sleep tonight, okay? And of course, gut issues. So these are mediators, things that maintain or worsen. Triggers. Triggers is when your patient says to you, ever since I went to Mexico and I had this really bad stomach bug. Ever since my divorce. Ever since my husband died. Ever since I went to college and my diet changed. We tend to dismiss that in conventional medicine. Yeah, ever since the accident. Okay, got it, who cares, right? No, these triggers, these are the moments that actually took your patient, whatever they had predisposed, whatever they have mediated, this is the thing that pushed them over the edge. Ever since I had COVID, right? This is the thing that pushed them over the edge. So it's not the thing, but it's not like, well, I can't, you had a divorce, that was traumatic, you lost so much, I can't undo that. But it just lets me know who that patient was, how fragile that patient was before this triggering event. But it also tells me that I have to focus a little bit about that triggering event. Because if it was also an emotional thing, then I will not be able to fully heal this person unless we also heal them emotionally. Because guess what? Things are connected. Okay, so that's triggers, ATMs. These are some of the things you'll see on the timeline. Okay, so just to put that together. Joanne, 45, with a family history of autoimmune disease. That's an antecedent, autoimmune disease. Experienced fatigue, joint pain, and migraines after mold exposure. The mold exposure was her trigger. Her high-stress job and inflammatory diet worsened her symptoms. That's her mediator. Right? Do we see how that flows? And then her functional medicine plan will target these ATMs. So of course we have to understand that she has an autoimmune issue, cooking. We have to understand that there's a mold trigger. We have to address that. And then we also have to talk to her how she's going to manage her stress. And that is how we're going to build her treatment plan, by understanding her ATMs. Mark, 38, family history of anxiety and depression, antecedent. Developed fatigue, joint pain, and brain fog after a stomach bug. That's the trigger. Though his gut symptoms improved and he began experiencing sensitivities to dairy, gluten, and sugar, which triggered inflammation and worsened his fatigue. That's his mediator. This thing happened. He's still eating the standard American diet. It's keeping him at bay. And his treatment plan is then going to include elimination, healing the gut, reintroducing some good foods, and helping to restore balance, and so that all his symptoms can go away. So we did the timeline. The timeline was how we got the history. Okay? That's how we started the history. Now we put it in something called the functional medicine matrix. So you already know what's in that column, your antecedents, your triggering, your medians. You already know that vertical column there. Let's take a look at this horizontal line here. The modifiable personal lifestyle factors: sleep, exercise, nutrition, stress, relationship. When was the last time you went to any, I keep saying primary care, but specialists too, and they said, how are you sleeping? Oh, your head hurts? How much are you moving? Oh, no. Oh, your knee hurts? What are you eating? Guess what? Joint pain is connected to food, right? No one ever asks these questions. And the purpose of this is to get a sense of what's happening in the lifestyle practices right now, because maybe that's a mediator. And also it's going to help us figure out what's going on and what the treatment plan is going to be. So we got the vertical, we got the horizontal. Let's go to the middle here. Around here is what I alluded to in our introduction: systems-based biology, defense and repair, energy, biotransformation, transport, communication, structural integrity, and assimilation. Now, we are very much used to looking at the human body through a different lens of systems: musculoskeletal, neurological, right, integumentary. But they're just systems that someone developed. We think that that's the only way to see the body, but there's other ways to categorize what's happening in the system. So here we have assimilation. Assimilation is digestion, absorption, so it includes the GI, it also includes the skin, different way of looking at it, also looks at lymphatic vessels, also looks at mitochondria, because mitochondria are off, that's how you get sick, that's how you age. Defense and repair, that includes our entire immune system, including the bone marrow, lymph nodes, thymus, spleen, mucosal linings, skin. Energy, we don't even have a system like that in conventional medicine. What does energy even mean? It's not even anything we talk about, but that's your mitochondria, but it's also your liver, your muscle cells. Biotransformation, elimination. We really just focus we monitor how much urinary output was if they're in the hospital. We help them deal with constipation or diarrhea. But are we really talking about elimination and biotransformation? Like, how is your body taking all the toxins that's in the world and actually transforming it and eliminating it? Is your body good at doing that? We don't even have a system we don't even talk about that in conventional medicine. Transport is how things get around. So yes, blood, but also lymph. Communication. What an interesting way to think about neurotransmitters and hormones. That's your communication system. Structural integrity is your musculoskeletal system, but also the structural integrity of the cell. And of course, these things are connected. So by setting up these systems, we can start seeing the interactions between things, and that's going to help us uncover root cause. There is a shift that has to happen. It's not going to happen right now overnight. They're throwing a lot at you, but it's from an organ-based systems approach, which focuses on individual organs, cardiology, neurology, and has no conversation about the interplay between them. Right? There's no conversation about the interplay between them, versus a systems-based approach, which is going to understand how things are connected and understand how one dysfunction in one area is going to affect the other. I'll give you an example of chronic fatigue. Someone comes in fatigued. What are we doing? We're doing a CBC. We're doing a TSH. We're going to figure out this person's fatigue. And if both are normal, you just need to sleep more. I can't help you, right? That's basically it. In functional medicine, someone comes low energy. I already assumed the TSH and the CBC was done, right? Other than, why are they coming? But now we're going to look at how's your mitochondria doing, right? Energy. What's going on with your immune system? Is your immune system working on overtime so you're so exhausted all the time? Is there some underlying toxin? The same fatigue that is really going to be dismissed of some form of it's in your head or you're stressed out. There's a whole world of functional medicine when we start looking at it through a different systems approach that can really come to play. So now there's a new understanding of the same slide as we put it together. Still in the functional medicine matrix, let's look at what is at the center of this matrix. What? Mental, emotional, spiritual? We did not come here for this, E. This is NPACE. We came here for the how do we fix the body? What do you talk about mental, emotional, and spiritual? What does this have to do with anything, right? When was the last time your provider asked you about your mental, spiritual, and emotional health? No? I know you're my go-to person. Thank you for being so accommodating, right? Has anyone ever asked that? But how can I possibly get you better if you're going home and there's severe stress in the house? How can I get you better if you're spiritually not connected? And if I don't at least ask, I'm going to get you gluten-free. How much gluten-free ice can you eat if you're still not getting better because you go home every day and there's an abusive relationship at home? How am I going to move the needle on your health, right? What if you're still carrying baggage from a lost one, from someone you lost? What is the diet going to do for you or the supplements going to do for you? Nothing. That's why it's at the center of this matrix. That's how we start to understand how we take a history, right? So this matrix takes the antecedents to triggers and mediators. In the center, we have this mental, emotional, and spiritual being. We have a brand new way of seeing the systems. We start looking at what's happening, how this person is living their life. And this is how you take a history, right? This feels very different than old cards, I'm hoping. Okay, so we start to see that with functional medicine, we get a comprehensive view, genetic, environmental, lifestyle. We start to identify patterns, and we're going to use this to create personalized plans. So, moment of deep breath. Everyone's okay? Okay? All right, good. So we recognize the differences. I would like to orient you where we are in the lecture. We examine the core principles. Now we understand timeline, we understand matrix, we understand ATM. Let's start seeing how some case studies, how we manage chronic diseases with this. So let's use these tools together. And of course, I have allergies at the most inopportune time. Thank you. Okay, being human is something. All right, let's just read this case study. 50-year-old woman presents with a complex set of chronic symptoms that have worsened over the past 5 years. She reports persistent fatigue, frequent colds and infection, GI issues, anxiety. Sarah also experiences intermittent muscle aches and joint pain, particularly after physical activity. Additionally, she has skin issues. By the way, this is a classic patient that comes to me, right? Everything. GI's a mess, joints are a mess, skin's a mess. She recalls a GI infection several years ago, after which her symptoms escalated through though no treatment has provided lasting relief. Her diet is limited due to new food sensitivities, yet her symptoms persist. She's just not getting better. She notes that her symptoms are most severe in the morning with some improvement throughout the day, rating her fatigue and joint pain around 7 out of 10 on most days, and it severely impacts her quality of life. Okay, this is old cards. I hope you could appreciate that we didn't even touch the surface, right? I'm not going to read this again, but it's so different. Before we were like, oh my God, old cards, they want so much information. I just want to say this person was here and she's tired. Now you can see that it doesn't even scratch the surface, right? So what are we going to do in conventional medicine for Sarah? CBC, TSH, let's check CMP. Maybe she's diabetic, she doesn't know about it. She has these frequent colds. If I'm really, really extra, I might do immunoglobulin levels, just maybe a chest x-ray. Maybe she has like pneumonia, she doesn't know. GI, I'm definitely sending her to GI. They're going to do colonoscopy, maybe abdominal ultrasound, maybe a CAT scan, right? I'm going to definitely send her to rheumatology, right? She has joint pains, no one can figure it out. Probably going to send her to psych, mental health, maybe send her for a sleep study. I mean, I'm hoping, I don't see a lot, yes, thank you for nodding your head, you're the best, right? But this is what we would do. We would do this for Sarah, and we would really, really think in our heart of hearts that we're doing the best, because she walked out with like 10 referrals. We did a lot of blood work on her. And, great. We're also great providers, so we're also going to manage her symptoms. Sure, we're going to give her something maybe for her fatigue, maybe some antispasmodic because her belly hurts all the time. Maybe we'll put her on antidepressant because obviously she's depressed, right? So that's got to be her issue. Again, right? We're going to give referrals all day long, and we're really just going to focus on trying to find a pathology. What's causing this? Is her thyroid? Is her anemia? And if I can't find a pathology and no specialist can find a pathology, it must be the patient's fault. They must be crazy. Right? That is the extent of it. This is the limitations of conventional medicine. So what happens to Sarah when all the tests come back normal? She's going to be told it's stress. She's going to be told it's in your head. So when we use the functional medicine and we're going to start all over with Sarah and we're going to ask her her entire health history, right? Not just old cards, and we're going to ask her what's going on in her life, how we got here, we're going to find out her family history, environmental exposure. We're going to find out that her family has a history of autoimmune issues. We're going to find out, whoever sneezed, God bless you, we're going to find out that as a child, she had antibiotics all the time, right? We didn't ask her that in old cards because we don't care. We're going to find out that in her old office where she used to work, she had mold exposure. It's one of the reasons she left. She never felt good when she was there. But so she thought maybe it was gone. By the way, it doesn't go away like that. And then nothing's been the same since her trip to her honeymoon to Mexico. And of course, she's chronically stressed. She doesn't eat so well. And she's just noticed that lately she's sensitive to all these different foods. And now she's just a hot mess. She's tired all the time. Her GI hurts. She's anxious. She can't get anything done. She's just not the same. So now we apply what we just learned, our systems biology approach, right? So we have assimilation issue, right? Because bloating, constipation. And we're going to learn about dysbiosis and leaky gut. Now we know she has a defense and repair issue because her immune system's shot. She has muscle aches. She has frequent colds. We know she has an energy issue, right? A concept that doesn't even exist. Persistent fatigue, low energy. We know that she has a biotransformation issue. We know that because she was around mold and she's not been better, so she has not eliminated this mold out of her system. She has fatigue, she has skin issues. We know that's a sign. You're going to learn in the next one that skin is belly. If your skin is off, your belly is off, you need to detox from something. We know that there's a communication issue because she has anxiety, mood swings, poor sleep. And we know she also has musculoskeletal issues, joint pain, muscle pain. So you see how from old cards telling her to go home, there's nothing wrong with you, to a brand new way of gathering information, there's so much that we could do for Sarah. It's a whole different playing field. So we integrate all this information and we create a personalized plan. And we identified her triggers are mold, GI infection, diet. We understand all the systems that are involved. And so we're going to, for assimilation, we'll give her an elimination diet, probiotics, prebiotics. We're going to fix her belly. We're going to give her anti-inflammatory. We're going to give her supplements that are immune modulating because she definitely has an immune issue. We're going to address her belly. Again, there are some mitochondrial things we could do to help support her mitochondria. There's some things that could help remove some of the load that she has on her. And we are definitely going to detox her from mold, which is a huge thing. I purposely left these slides here. I hope you get these slides because I left the information here dense so you could read it. But we're going to have to detox her from mold. And yes, she has a neurotransmitter problem, but she doesn't necessarily need Lexapro. Don't get me wrong, I prescribe it when needed, but she doesn't need it. What we're going to do is once we remove the mold, once we remove this thing that's burdening her and fixing her belly, we might need to give her something called adaptogens, which are supplements that help with your cortisol levels and help with your mood. We're going to talk to her about how she's going to sleep. We're going to help her improve her mindfulness. We're going to give her some things to help her with her inflammation. And now we could see the difference, right? Sarah went home before with, I don't know what's wrong with me, right? Maybe she decided she needs to work out even more or, go on anxiety meds and never really understanding what's happening. And so with conventional medicine, she gets medications, referrals, and a shoulder shrug. Don't know what to do with you, Sarah. We've reached the limits of what we could do for you in conventional medicine. With functional medicine, she has a 5-slide plan. It's a whole different mindset. Let's do one more. John, 48-year-old male, presents with chronic fatigue, frequent headaches, GI issues, brain fog, intermittent joint pain. It's progressively worse over the past 3 years. His symptoms began after a GI issue, and since then, he's been fatigued. It does not improve when he sleeps, and he has headaches. He takes over-the-counter things. His GI issues are unresolved. He struggles with concentration. At work, due to brain fog, experiences unpredictable joint pain, particularly after long work days. Multiple specialist visits, tests have not provided a clear diagnosis, leaving him frustrated and seeking answers, right? Another one of our mystery patients. He has a pretty healthy lifestyle. He eats whole food, lean proteins, vegetables, because he's tried, he's been on the internet and he thought if he changes what he eats, he'll be okay. He even goes jogging and yoga. However, his symptoms worsen during the work week and improves on weekends or on vacation. All right, he has a family history of autoimmune issues. Both his mother and sister have rheumatoid arthritis. He's worried, am I getting rheumatoid arthritis? And he has a high stress, high corporate job. And again, fatigues, especially in the office. So you guys already know conventional medicine, CBC, CMP, TSH, CRP. We're going to throw everything on him. We are going to make sure that the lab is really, really happy with everything we just ordered. And then we're going to send him for imaging, right? We're going to send him for MRI. We don't know what's going on. Does John have cancer? Like, what's happening with him? Was it abdominal ultrasound, endoscopy, colonoscopy? We're sending him for everything. Maybe some allergy testing. Why not? Right? We're definitely giving meds. Prescription for headache, laxative antispasmodics, joint pain, NSAIDs. He's going to get some antidepressants. Of course he is. He's so depressed. And lots and lots and lots of referrals because nothing is connected. And he has to go for every body part, park his car, fill out paperwork for each body part separately, right? It's kind of crazy when you think about it that way. So in functional medicine, of course, we're going to see, okay, antecedents, family history, autoimmune, joint pain. His RF is negative, but I know he's cooking all right because his mom had it, his aunt had it, and he has joint pain. We already know antecedents is his GI issues, his long-term exposure to high stress. But triggers is also the old office building. I think we all were thinking, oh, stressful work, high corporate position. He must be really stressed at work. Then when he goes on vacation, he's not stressed. He probably feels better. But what about the fact that that office building is full of mold? So that could be a trigger, right? And so, and the GI illness. His mediators, we know the stress is worsening it. He's constantly exposed to mold. He goes every day and he feels terrible at work. He thinks it's because of his stress, but it's actually because there's something in the walls. He has constant inflammation because he's a hot mess, and he has gut issues and sleep disruption. So again, I'm just going to run through this quickly, right? So now where John went home with referrals and absolutely nothing, in functional medicine, we are going to look at it very differently. We know he has assimilation problems, bloating, constipation. We know he has defense issue, frequent headaches, intermittent joint pain. Energy, fatigue is a mitochondrial issue, and your job is going to figure out what is sapping this mitochondria. Why is this person losing the energy? It's not in their head ever. Biotransformation elimination, we know he's having trouble detoxing from mold. Part of that is because he's exposed to it every day, but part of it is because no one's ever discussed it. There is no conversation about mold in conventional medicine at all. And of course, difficulty concentrating, brain fog, frequent headaches. By the way, if you leave John and you don't fix his brain fog, he will develop dementia. Because brain fog, dementia is here. With Alzheimer's, brain fog is here. You leave it alone. You leave this alone and say, it's just because I'm stressed. Anyone here experiencing brain fog, I need you to run to a functional medicine provider. That brain fog, you leave it alone, it's going to become dementia. That's neuroinflammation. We can't leave it alone. And it's not in his head, and he's not crazy. Communication issue. And of course, a structural issue. So we get a sense that the treatment plan changes, right? We're going to give him probiotics to treat his assimilation. We're going to fix the chronic inflammation with specific anti-inflammatory supplements because we know that the gut and the stress immune system are all connected. Energy, we're going to help him with his mitochondria, and we're going to help him detox. Detoxing protocol could be an entire day lecture, but I mean detoxing from molds, but I just want to let you know that this exists. And we have the gut issues. We're going to fix the detox, and because he has toxin overload. Okay, so you can see that the treatment plan continues on and on and on. So there is so much that we could do with John, right? So with conventional headaches, we're going to give meds for the headache, med for the GI upset. We're going to give referrals. And we're just going to wait. We're going to say, you don't have rheumatoid arthritis yet. Come back next year. maybe the RF factor will be positive next year, right? That's called a seronegative patient. Has symptoms, looks like a duck, walks like a duck, but their serum doesn't say they're positive yet. So in conventional medicine, we'll say like, come back next year, maybe the RF will be positive. Right now, you don't have RA, nothing I could do for you. In functional treatment, we understand, no, these symptoms mean that something's cooking, and we're going to start doing things right now. We're not going to sit and wait for the RF factor to come up, right? So we're going to start reducing inflammation, support the gut health, detox from mold, improve energy through supplements. And when we do that, the difference is instead of waiting for the RF, we could actually head it off at the pass. If we get his symptoms down, if his joint pain goes away and everything he feels go away, his RA may never surface. So we could actually prevent it because we know it's cooking. We know his antecedents. We know he's feeling it now. We don't need to wait for the serum to become positive to intervene. And then what are we going to do? Give immune modulators. Well, we could do so much right now. Okay, recap. So now we're understanding that the functional medicine approach offers comprehensive, patient-centered, that addresses underlying issues across all systems instead of just managing symptoms with medication and fragmented specialist referrals. We're getting a sense of the difference. No one's going to nod their head except for you. You're so good to me. Everyone else is looking at me like, I'm not sure if I buy any of this. Okay, so thank you so much for that. Okay, what is your name? Diana, you're like my angel today because you're not. Do you know what it feels like to not get head? It's nod your head. It's free. It makes me feel good. That's right. Okay. All right. So we recognize the difference. We examine the core principles. We review case studies. Now this is my favorite section. Is this timing real now? Okay, great. Because I want to make sure because this is seriously my favorite section. Amazing. Great. The new diagnostic tools. New labs that hopefully will blow your mind, especially the last one. The reason I said that is to keep you awake through all of them so you could pay attention to the last one. Okay. Okay, so probably never heard of these. Now, first, why do we need different testing, E? I have Quest, I have LabCorp, I don't know if I'm allowed to say names. I have all these labs, okay? I'm good. I could run panels from here to tomorrow. You need these because it's very, very different testing. Conventional medicine focuses on disease management, right? So it treats disease once they're diagnosed, right? Like as we said with the RF factor. And functional medicine really focuses on prevention and optimization. This is not something that we do in conventional. Let me take a moment. This is a slide I created a few years ago, and I think this really gets the message home about functional medicine, but also about testing. So on the bottom, where it says Alzheimer's, anxiety, autoimmune, depression, that's a disease state. Insert any disease state you want here. That is already sick. That is where kind of conventional medicine comes in. I could see that you already have, your A1C is high, your PHQ-9 is a mess. Like I could already diagnose you here. On the top are the things that I'm exposed to. My mold, my standard American diet, my stress, my COVID, whatever you want to, that is up here. Now, on the way from being exposed to being sick is a journey. And that journey can take years, decades. And during that time, you feel like ish. Okay? Yes, correct. Thank you. And that is when you feel fatigue. You're sick all the time, low energy, brain fog, abdominal issues, muscle, joint pain, leaky gut, hormonal imbalance. This is when you go to the doctor or the MP or the PA. And my wife's a PA, so shout out to everyone. This is when you go and all the tests are negative because you're not on the bottom yet, right? You have no disease yet. So you're crazy here. This is in your head, premenopausal, postmenopausal, you have kids, you're busy, you're stressed. This whole time while you're cooking your disease, conventional medicine cannot help you. You don't have anything positive yet. So this is the area of the mystery patient. They are on their way to finally, eventually becoming positive on some MRI or some CAT scan or a lab test. Okay, so this is the area where functional medicine testing thrives. Now we need both. We need both. I just want to say that because I've had patients all come to me because I do virtual consults all over the world. And sometimes they come to me and they're like, no, I didn't even go see a doctor yet. I'm like, this consultation ends right now. I won't even take you if you didn't do the conventional workup. you must do the conventional workup. It's not either or. Remember we said it's conventional plus another layer. So if someone comes to me and says, I have a headache, I'm not gonna be like, oh, is it mold? Ma'am, do you have a tumor? I need to know that first, right? We need to do MRI. Thank you for the head nods. I love you. Okay, right? So we can't skip that step. It's not either or. That's why it's not alternative. It's a layer above. It's another layer. So of course I want to know if you have disease. Of course I want to know how your organs are doing. How's your kidney doing? How's your liver doing? Of course I don't want to know your cholesterol and your A1C. I want to know if there's a pathology. If you need a biopsy, get it done. But on top of it, if I'm going to see what else is cooking, what else is happening. Fair? Awesome. Everyone's nodding their heads. I love you. The best audience ever. Okay. So let's start with the GI map. GI map, I am not affiliated with any of these companies. These are just companies that I use over time. And I just want to introduce you to them so you can understand what's out there. Okay. So the GI map, it's a stool test, and it lets you know what's happening in the microbiome. We don't have a test like this in conventional medicine. We could do like ovum parasites, C. diff, but like what is actually in your microbiome? This is great for the patient whose stomach hurts all the time. The IBS, that's not a thing, by the way, IBS. This means you haven't figured it out. You have the symptoms, they're real, but you haven't figured out what's causing it. That's all, it's a placeholder. If you got that diagnosis, go find a functional medicine person. No, not it. I mean, do the GI first, remember? Yeah. No, the GI won't be able to find it, right? You already did the GI. When the GI fails, you find a functional medicine person. Pay attention. Okay. Yeah, we will. All right. This is what the results look like. I want you to see what it looks like. This is something we just don't get. We just don't get this conventional medicine. Take a look. Need for digestive support. Does this person have maldigestion? Does this person have inflammation? Does this person need microbiome support? Do they need some probiotics? Do they need, is there some sort of underlying pathogen that maybe we don't know about? I mean, it's pretty cool results. And take a look at this page. This lets you know, gives you like a visual glimpse of your microbiome. You don't want to be in the red. That means you have more, it's really, really imbalanced. Just like a quick overview of what I mean by imbalance. There's good bacteria, there's bad bacteria. You need both, but you want to have more good than bad. There needs to be a certain balance, okay? Because they're all connected to the craziest diseases you can imagine. Everything's connected to this. So you want to be in the green. If you're not in the green, you're going to start creating interventions to move the patient into the green. And then guess what happens? Their headaches go away, their psoriasis goes away, their eczema goes away, their depression goes away, their joints feel better, okay? So comprehensive stool analysis. So again, it gives you the pathogens, tells you what's going on with the bacteria. I think we went over this one. And then treatments come from that. Probiotics, prebiotics, sometimes antimicrobials. If there's a pathogen, you're going to give antibiotics. They might need digestive enzymes, and they might need dietary modifications. SIBO breath test. Small intestinal bacterial overgrowth. We're supposed to have some certain bacteria here that are not supposed to go up into the small intestine. And when they do, it's a problem. This is a breath test that you do. So the patient that comes here, bloating, gas, no matter what I eat, I'm constantly bloated. I've been to the GI, I've done everything. It's a breath sample. You have to drink this disgusting drink. And then after that, you breathe into a bag. It's kind of similar to H. pylori if anyone's done an H. pylori test. And if there's an overproduction of certain gases, that means the bacteria are in the small intestine because it's coming into this bag. And it just lets you know. This is what it looks like. And you see that suddenly there's a higher concentration of hydrogen and methane, and that lets you know it's not supposed to be there. SIBO is probably present. For SIBO, small intestinal bacterial overgrowth, sometimes you need antibiotics. Sometimes you could get away with herbal antimicrobials, depends how bad it is. You're going to need things to help move the gut along because you don't want things to sit there, because if it sits there, it ferments, it makes it worse. And you're going to need, if anyone's heard of a FODMAP diet, I wrote down what FODMAP stands for. I can never remember it, okay? Fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. It's like the most complicated. I always have to look back to see what it is. So if you don't know, that's okay. But the point is, the reason we do low FODMAP diet is because we're trying to make sure that since there's a big mess, fermenting mess high up in the GI, we want to make sure to make things move fast and to give things that the bacteria don't really enjoy eating to help that along. All right, so we did stool. Let's move on to urine. The Dutch test, very, very popular. dried urine test for comprehensive hormones. What? Hormones through urine? That's crazy. We only do it through blood, and we hate doing it anyway. We send everybody to the GYN. We don't like to do it, right? So the Dutch test evaluates adrenal function. Who's evaluating adrenal function in conventional medicine? Nobody, right? But if you're having fatigue, you probably have a cortisol issue. If you're anxious, you're having a cortisol issue. We need to test your adrenals. So we'll also test your sex hormones. This is for your patient that has PMS, PCOS, menopausal symptoms, andropause symptoms, or adrenal fatigue, right? Constantly tired or really, really wired, can't fall asleep. These are all the adrenal people. Conventional medicine would have you believe that adrenal only has two things. Everybody's normal, and then you have Cushing's and Addison's, but everyone in the middle is normal. That can't possibly be the case. There is a whole world of adrenal fatigue that can be looked at. And the results lets us know your adrenal health, lets us know how your sex hormones are going, and lets you know sleep and recovery. It gives you a lot of insight about things that you really don't discuss in conventional medicine. This is what it looks like. Really complicated. Pretty cool, right? Comprehensive. Never saw that before. Okay, and then you have a treatment plan. If they're high cortisol, you give them some things to bring it down. If they're low cortisol, you bring some things to bring it up. Same thing with sex hormones. Do they need something to bring down? They're too estrogenic or too low. Maybe they need bioidentical hormone replacement therapy. We should do a whole lecture on BHRT because everyone should be on it postmenopausally, period, full stop. And high testosterone, if they have high testosterone, low melatonin, high melatonin, these are things that we can discover about our patients and actually help them, right? But these tests don't exist. Organic acid test, known as the O test. This basically is anytime you have a chemical process in your body, it makes organic acids, and we test the organic acids, and if they're present, we can make assumptions that certain things happen. It's a urine test. This is great for your chronic fatiguers, your fibromyalgia. Fibromyalgia, it doesn't mean it's not real. It's real. Your symptoms are real. It just means your conventional medicine person has not found why you're tired. Okay? Don't accept it. If you got that diagnosis, run. And so when you have someone who's tired or fatigued, we're going to suspect mitochondria. I think by now you understand that. It's a urine first morning sample, and basically it gives you a whole list, I'll show you, of organic acids, and you can start understanding what's happening with the gut, what's happening with energy, what's happening with detox. This is what it looks like. And then the type of support you'd give, right? Do we need mitochondrial support? Do I need to detox someone from someone? Do they have candida overgrowth? Do they have, like, what is going on for them? Heavy metal testing. Heavy metal testing, blood, urine, hair. Basically, it's exactly what it says it is. It detects toxic metal exposure, lead, mercury, arsenic that you may not know you have because we don't test for in conventional medicine. This is classic for your neurological symptoms. Classic neurologic symptoms. Why is somebody suddenly having tremors? Suddenly have cognitive decline, memory loss? We should think about that. Chronic fatigue syndrome, unexplained symptoms. The patient who's tired all the time, no matter how much they sleep, something to consider. Maybe they have this burden that they can't get out. This is what it looks like. Now, almost all of us have some metals inside of us. So there's a lot in the green on this patient, and there's only one thing in the red. And so if you get testing, just so you know, anticipate seeing a few things there, which is okay. There's a certain amount that we can handle. There's a load, a toxic load that we can handle. And then when we can't, what we need to do for that is we need to do something called chelation treatment. And chelation therapy is, through IVs and other ways to detox. Way beyond the scope of this, but I just want to get you a sense of what's available out there. This one I do all the time. You saw that in my case studies. I brought mold in. I see mold all the time. I see mold all the time to the point where it's scary that we don't talk about it in conventional medicine. Mycotoxin testing, mold testing, it screens for mold. Okay? If you've been through everything and you've gone through it, consider mold. Consider mold. You have nothing to lose. It's like a $200 urine test. So your chronic fatigue, cognitive dysfunction, brain fog, memory loss, respiratory issues, all linked to mold exposure. It's a urine test, and it tells you this is what it looks like. Okay, so on this, the one with the bar tells you kind of what's an acceptable amount, and if you're above the bar, you have too much mold in your system. You need to be detoxed. So this patient has a lot of different molds. in their system. And it's over time, because if you just take a look at the gliotoxin there, if you noticed, it's over time it was very high. This is somebody who was received a binding protocol, and now it's lower and lower and lower. And that's what we want to see. So there's objective ways to not only test what's going on with the patient, but to test how they're doing and how your treatment's working. Again, detox protocols, this is an entire day, if not a lifetime, of learning from mold testing. And then, of course, that patient is also going to need to change where they work. I've had patients who were working from home from COVID, and they set up shop in the basement. And that was it. The headache started, the fatigue started, they had no idea what was going on. Some of them actually left their careers because they thought it was stress from their careers. No, it was their basement. And by the way, no visible mold. It's still in there. So a huge thing to consider. All right, we did urine, we did poop, let's go to saliva. All things we don't really use in conventional medicine. Salivary hormone testing, this is how I like to test for hormones on my patients. It measures levels of key hormones, including estrogen, progesterone, testosterone. And again, when you see the classic symptoms, fatigue, mood swings, PCOS, libido, sexual dysfunction, you're going to want to do this. Saliva, you spit into something like 4 times a day, you send it off to the lab. And then again, results. How are the estrogen and progesterone doing? How's testosterone? How are your hormones? Like, what's the ratio between them? And this is what it looks like. Very easy for the patient to understand. This is why I really, really love this one, because if you saw the Dutch test, it was really complicated. I really love this one because the patient could see, oh, blue arrow down. I need some more of that. Green arrow, good. Right? Really simple to manage. And then, of course, the treatment accordingly. We treat low, we treat high as we need to. Salivary also does cortisol testing. This is what I was telling you earlier about adrenal fatigue. Adrenal fatigue is a big issue. If you're someone who has that afternoon slump, right? I'm great till lunch. After lunch, I'm worthless, right? How many people feel that, right? That's not normal. That's not okay. It's not because you're 50. It's not because you have kids. It's probably because your cortisol level drops. Let me show you what that looks like. It's a saliva test. Again, it could be high or low. This is what it looks like. Not to get too into the weeds here, but you need to be in the green. Super high in the morning. And then as the day progresses, it goes lower, lower, lower. Then you go to sleep. That's the perfect, I've never seen that in my entire practice because people come to me are really unwell. This person, look where their dot is. This person wakes up probably exhausted. They can't muster up cortisol in the morning. They're supposed to be in the green. They're below the green. This is an exhausted patient. By the way, this patient, take a look, the next plot line is around lunch. They're all right. But then look, they go up a little bit after lunch. This is somebody who probably gets like a second wind right before dinner time. These are all things we can track and measure. So when I tell that to a patient, will be like, oh my God, that's exactly me. I get everything done right before the kids come home or when the kids come home. It's really stressful in my house. So we can actually measure it and then use supplements to help this along. This person needs supplements to give them energy in the morning, and they're fine in the evening. Some people spike at night. We need to give them something to help them calm down, right? They're not crazy. Again, I think I went through this. These are the possible treatments that come up from salivary cortisol testing: certain herbs, nutritional support, lifestyle changes, and hormones if necessary. Lyme. Oh, this is another one that agitates me. Okay, you're nodding your head. Yes, yes. Lyme speaking to you? Good, amazing. Lyme table over there. Great. If it's not contagious, you could say hi. Okay. All right, Lyme. You're going to say to me, I don't need a Lyme test. I already have somewhere to go with Lyme. Okay, so here's the thing about Lyme testing. If you're positive in conventional medicine, if you come up positive, God bless, it's a positive. If you're negative in conventional medicine, it is not negative until you do one of these tests. Okay? Do not trust a negative in conventional medicine testing. Okay? And I'll explain to you why. But this is for the patient, again, if we're thinking Lyme disease. They have fever, chills, joint pain. They're hikers, they're walkers, they walk their dog all the time. Like, this needs to be up in our mind. And they said, oh, I already went to my doctor, and he said, I don't need anything. And he said, I'm negative. Okay, you're going to do a blood test, and you're going to send it to a different place that tests for chronic Lyme. Chronic Lyme. Another full day weekend session. But conventional medicine does not recognize the term chronic Lyme. According to guidelines, you're positive, you get antibiotics. If you have any symptoms after the antibiotics, it's not because you have Lyme anymore, it's because you have post-treatment Lyme disease syndrome. That's as far as they'll give us. They'll give us like, all right, you still don't feel good. All right, it's post-treatment, you'll get over it, okay? But it won't acknowledge that you're still infected. It won't acknowledge chronic Lyme. So in functional medicine, we know, I shouldn't say believe, we know that chronic Lyme is gone by ongoing infection. This is very different because if it's post-infection, you don't need any antimicrobials anymore. You just have to get over it. But if I understand that maybe there is a chronic infection, my treatment really changes. You might need to be on antibiotics longer. You might need other type of antimicrobial support. It's a whole different world. And let me explain to you why. Regular labs use the ELISA and Western blot, which relies on antibody detection. I have an infection, I mount an antibody, I take a look at that antibody response, that's my test. And it also only tests Borrelia, right? It doesn't really go past that. In specialized labs, they don't just look at the antibody, they look at antigen detection, they look at immune panel reactivity, and they look for co-infections. It's more sensitive to chronic Lyme. So you might be so unwell that you're not actually mounting a response. I'm looking for antibodies, but you might not even be able to produce antibodies. And that's why that negative could be a false negative. So there are tests out there that test this whole reaction in your body so differently. And that is why chronic Lyme exists, because you're walking around with a negative or treated a positive. You think it's done, but in fact it's still there. And there are tests that can prove it unequivocally. And then, of course, your treatment completely changes, right? You're actually going, some people need to be on antibiotic therapy much, much longer. Okay, we're almost at my favorite one. We're not there yet. But hopefully you're like, how are all these things existing and I didn't even know about it? I'm hoping that that's what's happening. If you're slightly overwhelmed, good. That's supposed to be overwhelming to make, your juices flowing. Food sensitivity panels, not the same as food allergies. Not the same as food allergies. Food allergies are an IgE response. I eat a banana, I get a hive, I take Benadryl, it goes away. I go to the ENT allergist, they do the thing, I could see all the mosquito bites, I circle it, I get a panel. That's allergy testing. Food sensitivity is not that at all. Food sensitivity tests something called IgG or IgA, different reaction. So what does that mean? So if I eat a banana and I get hives as IgE, I eat a banana, I'm exhausted, I get migraines for the next 3 days, IgG, IgA, okay? I have an avocado, it's a superfood, this is a true story, one of my patients, it's a superfood, I would never tell someone not to eat an avocado, she's not allergic to it, been eating it her whole life, she loves guacamole, I eat it, my psoriasis flares up, okay? That's food sensitivity testing. She will come up negative for IgE testing. And this is, so food sensitivity testing is a whole different world. So your body actually develops antibodies to it. By the way, those antibodies can then show up and trigger the autoimmune response. Gluten triggers Hashimoto's. Certain foods trigger psoriasis. Certain foods will trigger eczema. So food allergies, food sensitivity panels is a whole new world, not covered by insurance and not seen in conventional medicine. This is what it looks like. It literally goes line by line. It's like a 10-page report. This particular person is very lucky. She or he only has like 2 things in the red. We will remove peas on this person, and their life will change. Their life will change. Since we're a little, yeah, we're good. So that's food sensitivity. So IgG, IgA, and then of course we're going to eliminate if we need to. Then we're going to heal their belly. And then we're going to do some nutritional counseling. By the way, psoriasis, since I have a few extra minutes, psoriasis is the reason I got into functional medicine. This is 1,000,000 years ago. I am a dinosaur before the internet. What it is. My wife had severe psoriasis and something called PMLE, polymorphous light eruption. And all that was offered to us was medicine, 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 and just live your life. I mean, she was bleeding. She couldn't open up her shirt. She couldn't put on shoes. The soles of her feet were bleeding. And I was like, there's got to be something better. And someone told me about functional medicine. I was like, that sounds crazy. I tried it anyway because I had nothing to lose. For her, she was vegan at the time, so her diet really existed of corn and soy and breads because that's what she did. And it turns out that gluten, corn, and soy were her enemies. Took it out of her diet, psoriasis disappeared, and PMLE means we lived like vampires for 20 years. We couldn't go anywhere, and suddenly we can go out in the sun with a change of nutrition. And when I saw that, at that point, I'd already had my primary care practice. I'm like, what am I doing with my life? There is so much more out here, okay? And ever since then, I've just been like deep in the vortex. So just food sensitivity panels is really amazing. Leaky gut, there's some tests there. I'm not gonna go into there. I wanna go to this one, okay? I'm hoping to blow your mind because I put the slide there, so I'm hoping you'll be like, well, who cares about that? No one even cares. What are you talking about, E? Alzheimer-associated immune reactivity, okay? You can test before it comes, okay? Is that blowing your mind? Oh, look at it. Yes, thank you so much. Thank you. All right, so the slide was correct? Okay, this does not exist in conventional medicine. What happens in conventional medicine? I think mom's losing it. Let's go to neurology. Neurology does the mini mental. She's good, mom's good. She's fine. She's bored, give her a hobby, you know, right? Let her start pickleball. Okay? Well, pickleball is really good for you, although I don't play it. Okay. Not me, sis. I look athletic, but I'm not. Okay. Okay, so there's actually a test. There are a lot of tests out there. I'm just putting one up here because it was Cyrex, which is the lab I use. But there are a lot of tests out there in this world that can let you know, is Alzheimer's cooking? We're not going to wait for you to fail the mini mental. And then what? What happens when we fail the mini mental? Do we have a cure? Do we have a medication? No. So then you're like, okay, I think she needs an aid now. Like, that's it. That's all we got. Don't fail, don't fail, don't fail. Fail the mini mental, get an aid. Take something to help them sleep. Take something to help their behavior if they're agitated. That's all we got for Alzheimer's. That's all we got. But there is a world where we understand that Alzheimer's is neuroinflammation. This is a whole topic by itself, but it's neuroinflammation. I have body inflammation. I have GI inflammation. You think it just stays here? When I finish bloating, that's it? It's gone? No, it's everywhere, including your brain, neuroinflammation, brain fog. So I said to you, leave that neuroinflammation, the brain fog alone, you get Alzheimer's. But we can intervene. We can intervene way before. So this particular test for elevated antibodies to beta amyloid, which kind of, if you remember anything about Alzheimer's, that's the tangles and the plaques in the brain. Elevated antibodies to tau, reactivity to neural proteins. And it looks like this. It's a test. It's a blood test. And I could see if brain fog is really meaningful for mom. And then I'm going to put her on a ketogenic diet. I'm going to introduce intermittent fasting. I'm going to make sure she starts doing puzzles. I'm going to put her on some anti-inflammatory supplements. And guess what? Her brain fog is going to go away, and I'm going to be able to prevent this. I'm going to be able to prevent this. It's not inevitable. Alzheimer-associated immune reactivity. There is so much out there. There is so much out there. There's gluten and wheat sensitivity, which is not the same as celiac. I get it. And GI likes to say, oh, you don't have celiac. Celiac's so trendy. You're not allergic to gluten, or you're not insensitive to gluten if you don't have celiac. Not true. There's a whole world of non-celiac gluten sensitivity. We could test for it, even if you don't have celiac. There's cross-reactivity foods where I'm not eating gluten anymore, but I still react like I'm eating gluten because it turns out your particular body is going to respond to quinoa as if you're eating bread. Guess what? I could test for that. Pathogen-associated immune reactivity in chemical environment, like what's happening in our world. There's so much more, right? This is just a list, kind of never ends. So, amazing. Perfect. So let's see what that looks like. 34-year-old woman with chronic fatigue, digestive issues, hormonal imbalances, right? So now we're not just going to do the TSH and the CBC. No way, not after this class. We're going to do stool analysis, hormone panel, food sensitivity testing, and now we have a whole new set of interventions, right? We're going to do probiotics, prebiotics, antioxidants. We're going to balance her hormones. We're going to eliminate, and we're going to fix this 35-year-old female with chronic fatigue. 40-year-old chronic fatigue, bloating, joint pain. Again, we'll do stool, we'll do salivary cortisol, we'll do micronutrient testing. Way more than TSH, CBC, and an X-ray, right? Now, not instead of, on top of, and then we're going to analyze, interpret, and treat. Right? And then the patient is going to come back and say, I feel better. My energy's back. I feel like I did before. Thank you. right? My belly's better. My brain is better. Everything is so much better. You could actually move the needle. And not only do they feel better, but now you're understanding that you've just prevented the disease that was coming to a theater near you, like, right, 10 years later. Okay, so we're almost there. We recognize the differences. We examined the core principles, our timeline, our matrix. We reviewed some case studies. We just saw some really, really, really cool tests that we never even knew existed. And we're going to put it together, some protocols, some pharmacology, and some of supplements in a clinical practice. Great. Emily, 42-year-old female, comes into the clinic with a range of chronic symptoms that have progressively worsened over the past few years. She reports persistent GI issues, including bloating, gas, intermittent diarrhea. Additionally, she struggles with chronic fatigue, frequent headaches, joint pain, and unexplained weight gain, despite no significant changes in her diet or exercise habits. Emily also has mood swings, increased anxiety, and difficulty concentrating. Her childhood, she had frequent ear infection, was treated with multiple rounds, because now you know we're going to ask these questions. 20 to 30s, she experienced high levels of stress. She had a demanding career in finance and really irregular eating habits. Recently, she was diagnosed with hypothyroidism and has been on levothyroxine ever since then. And she's also developed a new sensitivity to food that's previously, that she used to tolerate, especially gluten and dairy. Okay, so her diet's full of high processed foods. She admits to eating frequently on the go. She works out a little bit, not so much. Super high stress job. She doesn't sleep very well. And she's really frustrated. This is the patient, I know you all see this patient. She's like, I can't lose weight, even though I try to eat healthier. Everything seems to be worse. I've been to my primary care several times, and they just offer me like weight loss medication, and may or may not work. But I really want to explore a functional medicine approach to understand why all this is happening. Why do I not feel optimal? Right? So, of course, for a symptom, we're going to give her all the meds for her GI, her fatigue, for her joint pain. We're going to do the standard test, but now we know that's not going to fly anymore. And we know that conventional medicine is really going to be like, well, of course you feel this way. You have a thyroid issue. Of course you feel this way. And mood swings is, of course, because you're female and you're 50, so obviously you have mood swings. And fragmented care, she's going to go to multiple specialists, and the GI is going to manage GI, the musculoskeletal is going to manage a joint, everyone's going to do something else. Okay, now we know the ATMs, we applied the ATMs, we understand now, we're going to look at her story very differently in the old cards. Her childhood, frequent ear infections, treated with multiple rounds of antecedents. This is setting the stage for a microbiome issue later on. This is an antecedent. In her 20s and 30s, she had stress. That's setting the stage for what's going on today, but it's also not allowing her to ever recover. And then again, she was diagnosed with hypothyroidism, so we already know there's a disease going on. She developed new sensitivity to foods. That's both a trigger and a mediator. Her diet is definitely worsening things or maintaining status quo, but they're also becoming triggered because it's starting new inflammation, and that inflammation is worsening her symptoms. We know that her diet is high in processed foods. That's a mediator. She cannot get out from under if she's still eating high processed foods. She's never going to get better. She also doesn't really move much. That's a mediator. Until we get her to move, that doesn't mean she needs to be high intensity workout. It just need to get her walking. We also know she's under a lot of stress. That's a mediator. And she's not sleeping. That's a mediator. So how is she going to get better if we don't fix all these mediators? We're going to apply our new systems biology now that we understand how we're going to do it. We understand she has an assimilation problem. She has a defense and repair problem. She has an energy problem. She has a biotransformation elimination problem, right? She cannot detox. She has a transport problem because she's fatigued and sluggish. She has hormonal communication problem. She has a structural integrity problem. So now we're starting to see her and understand what's going on with her in a whole different way than just, I don't know, maybe she should sleep more. And we're going to do our testing. We're going to do a GI map on her. We're going to find out that she has overgrowth of yeast, Klebsiella. She has inflammation in her belly, and she does not have enough of the good stuff. Then we're going to do a Dutch test on her. And we're going to find out that she has really low morning cortisol. No wonder she's so tired and can't get out of bed. She doesn't have cortisol. We're also going to find out she's estrogen dominant, which has a lot of ramifications for her depression and her anxiety. We're going to do food sensitivity testing and find out that even though she's eating like a whole wheat sandwich because she thinks she's doing better, she's so sensitive to gluten that it gives her immediate postprandial fatigue. And then her thyroid antibody test, we're going to see that, that she has anti-TPO, so we know for sure that her thyroid is also in autoimmunity, so we know that all this is triggering and worsening her autoimmunity. And then because we asked all the questions and because we did all the testing, our treatment plan changes, right? It's not just go home and take a nap. We know we have to fix her GI because the GI map. We have to give certain supplements for her defense to reduce inflammation. We have to give certain supplements to fix her energy. We have to help her detox. We have to help her bring that estrogen level down. Her estrogen level is too high. She has transport issues. We're going to talk about hydration and exercise and maybe saunas, communication. You're going to see in the next lecture that serotonin is made in the belly. It's made in the belly. So if my belly's off, how am I not going to be depressed? I'm not making enough serotonin. And structural integrity. So the treatment plan, everything changes once we use this. Make sense? Cool. We need some pharma, so we're going to do some pharma. Okay. But this time, it's going to be about supplements. And what I want you to get from this piece, you can have these slides, what I want you to get from this is that you need to think of supplements not as expensive urine, as my friend here said, but as true interventions. There is dosing, there's contraindications, there's usage for it, and really start utilizing them or thinking of them in a completely different way. Okay, so let's just do a gut healing protocol. I'm almost there. These want 10 minutes, I know. Yeah. Watch how fast I go through this. Gut healing protocol. Berberine, L-glutamine, probiotics, digestive enzyme. I did this. This is, in my opinion, the boring part, so I'm going to go real fast through it, okay? So berberine. I'm not reading this, but I want you to see there's an action, indication, dosage, contraindication, drug interaction, and side effects for berberine. And you're going to use it to regulate blood sugar. L-glutamine, it really helps repair your belly. Again, there's a dosage, there's contraindication, there's drug interactions, there are side effects. Probiotics. Probiotics are serious business. Probiotics restore gut balance, right? They help your brain. They help so many things. There's ways to use it, and there's dosages. Enzymes. Some people, seriously, the food just stays in their belly. They don't have enough enzymes. You're going to give digestive enzymes, and that's going to help their bloating, their indigestion. There's dosage, and there's contraindications. My patients with chronic fatigue syndrome, there's things that we can give. CoQ10, mitochondrial booster. We always think of CoQ10 that has to do if you take a statin, take your CoQ10. I mean, yes, but not enough. It also gives you energy, okay? And there's some other ones here. And this is why they work, the science behind each one. CoQ10, how it works on ATP and mitochondria, indications and dosaging. Mag-glycinate, okay? I have no problem sharing. I'm taking pictures, but I'll share it with you. Mag-glycinate, again, what I love about magnesium glycinate is that it doesn't give you that GI disruption that sometimes magnesium citrate does, and it is amazing. Mag is magic, okay? Over 300 reactions in your body happen with magnesium. Almost everyone in this room is magnesium deficient. Why? It's not in our soil, it's not in our food. So magnesium is like magic. Rhodiola rosea is one of the things that help boost your cortisol. Now you understand in adrenal fatigue that you're going to use that. Hashimoto's, I'm going to show you this. Selenium, vitamin D, and zinc. I just want to show you this. T4 to T3. T4 to T3, the active form. What do you need? Protein in your food, zinc, iodine, selenium. You don't have these three, you are not converting T4 to T3. It's simply not happening, and then you're walking around feeling sluggish. And this is the mechanism of action for each one. Same thing with anxiety and depression. You have very specific supplement, 5-HTP, GABA, omegas. Last is, what do I do next? Because you're like, what am I going to do right now? What you're going to do is you're going to keep studying because this is a lifetime of things. And until then, you're going to refer. Refer to someone like me, not me, I don't see patients anymore. Refer to someone like me. And the point of all this is so that your practice, if a patient comes into you and they're a mystery patient and you don't know what to do with them, after this lecture, you're not going to know what to do with them, and that's okay. But you're going to know that this exists, and you're going to find them someone, and you're going to say, I believe you. You're not crazy. I can't solve it, but I'll help you find someone who will. Thank you.
Okay, we have a good bit of questions. Does insurance plan cover functional medicine consultations? If not, what can a patient expect to spend?
Okay. Insurance does not cover it. It's not possible there. I've seen some practices that they attempt to do functional medicine through insurance, but they will go bankrupt because you know that insurance pays what it pays for one visit, and you need to spend time in your visit. There's no code out there. I have a primary care practice as well. There's no code out there that I know that will cover an hour with a patient that will equal to the 5 patients that you lost that you could have seen that hour. Okay, so there's no code. What can you expect to pay? It depends. A consultation can range anywhere from, at minimum, I've never seen less than $300 for a consultation to several thousand. But then it's the treatment. You need someone to pass the consultation. So it's going to run you several $1,000s.
Okay. Let me find the next one. Hold on. How do you guide a patient who asks if there are interactions between their functional medications and traditional medications? Katie states that they have had multiple patients ask before, but can't ever seem to find a good resource to guide them.
There is a good resource. I forgot the name of it. I will find it for you and give it to you. But there is a good resource where you could plug in your supplements to your medication. Yeah, because you're right. The EMR doesn't recognize them. You put them in the EMR, they're like, whatever. You can't even find them in the EMR. But there is a good source. I'll get it for you. Excellent question.
How does a FNP learn more about functional medicine?
Okay, so it's never ending. So Institute of Functional Medicine is great. And there are a lot of other, like courses out there, but it's never ending. And you kind of find your groove and the thing that speaks most to you, and you deep dive and you just keep going.
Okay. How do you reconcile the fact that these tests and this approach is only accessible to such a small amount of people due to the high cost and insurance not covering?
I don't reconcile it at all.
Okay.
I think it's terrible.
Is there a correlation with exposure to metals by the use of cookware and use of plastics? And what do you recommend regarding this?
Yes, and Teflon. Yes, cookware, Teflon, plastics, especially if you microwave your plastics. Yeah, I mean, it all depends how deep you want to go in the rabbit hole. By the way, the rabbit hole is never ending. You can go forever. It also depends how sick you are. My really, really sick patients, everything, including the cell phones and the Wi-Fi, will make them unwell. So you don't have to go into the vortex. Start with your diet first. Then you go to the test. Start with the obvious things first. And then if you're still not getting better, then you start looking at your cookware and your plasticware. So yes, it's leaching. Yes, it's coming into you. Is it the cause of your problem? Not sure. But that's not where you go to first.
Do you have patients that come to you for weight management, obesity? What is your experience with functional medicine approaches to weight management and the treatment of obesity?
I do not take patients for weight management on obesity. I never focus on weight or how much you weigh. I focus on what is making you unwell. Where is the cause of your inflammation? I don't care how much you weigh. I have very thin people who are markedly unwell and heavier people who are getting better. And generally what happens is as we fix your inflammation, as we get you better, you lose weight. But if we focus on the weight loss and not on the toxicity, we've missed the entire conversation.
Okay. What is functional medicine view on vaccinations?
Oh, I'm not touching that. Next question.
Okay. Oh, God. Oh, Jesus.
I'm trying to get out of here with my legs intact.
Okay.
There's no way I'm winning this conversation in either direction.
Where should a patient be sent for functional medicine? If not sent, how do you order the testing that you discussed?
Any of you can order the testing. You need to be just a licensed provider. You set up an account with any of these companies, Cyrex, Dutch Test, all these tests. So you can all order it. And these companies tend to be really great on educating providers because they want providers to use it. But if you don't want to manage it because it's out of your wheelhouse, just do a Google search, functional medicine near me. Give that person a call. See if they resonate with you. And say, how do you take patients? How can I refer patients to you? Like, make sure this is somebody that you're vibing with. If you're bored, I have a podcast, and I interview a lot of disruptors all over the country. So maybe there's someone near you that you can find.
Okay, I think that's it.
Oh my God. Thank you so much.
Wait,
Thank
no,
you.
go back. Stop. Wait, people added more. Sorry.
Keep your clamps.
Sorry, you're
Save them
going.
up so they can be louder
Hold
after
on.
this
We have
question.
5 more minutes. What supplements do you trust?
What company like?
Supplement
But
brands.
supplement brands. Okay. Good question. That's not like considered like commercial. Like I can answer this question.
And just say that company is not paying you to answer.
Oh,
if
yeah,
you're
no one's
employed
paying
by
me.
any of them, no, you cannot answer. If they do not pay you for anything, you can't answer.
Okay, no, they're not paying me. I really like Apex, but you cannot buy Apex directly. You need to go through a provider. I just love like their quality control. If I had to go through Amazon, I like Body Balance and Thorn.
Thorn,
Yeah.
okay. I know you kind of answered this already. You said it cost about $300 to over a couple of $1,000s, but this person asked like a ballpark figure of treatment in functional medicine, and I don't know if they're
Figure
asking.
for like a year, you're in for at least 10,000.
Oh, okay, okay,
For like a year, somebody should be guiding you for at least a year because nothing happens in 30 days, 60 days, and 90 days. You need a guide for a long time.
okay. Can you touch a little more on hormone replacement, systemic versus local for general population of us postmenopausal women out here?
Yeah, BHRT, bioidentical hormone replacement therapy, is something that every postmenopausal woman should be on unless she had an estrogenic related cancer. But outside of that, everyone should be on it. It is not just for hot flashes. It is for Alzheimer's prevention. It is for heart attack prevention. It is for osteoporosis prevention. It is for longevity. So even if you're lucky enough not to have a hot flash in your life, you should be on BHRT because you want to be able to, do whatever you want to do at age 80. I love transdermal. I like compounded pharmacies for it because you can customize it. Oral progesterone, transdermal, estrogen, and testosterone.
Great. Can you recommend a good mold testing company?
Yeah, real-time labs.
Okay, real-time labs.
Yeah.
Okay, that really is it, I think.
Okay. Thank you so much. Thank you.